how do you recognise a heart attack? Well, in the A&E, we often run into people who are screaming in pain. And very often, they aren't having a heart attack. What I've learned over nearly 10 years working in emergency departments is that the most dramatic pain is rarely cardiac, and the most dangerous heart attacks are often disturbingly quiet. The person having a heart attack is usually the one sitting very still in the corner of the waiting room, pale or grey, clammy, holding their chest, speaking softly if they speak at all. They're not shouting, they're not crying out, they're just sitting there looking absolutely terrible. I'm Dr. Alex, and I've spent almost a decade working in emergency departments across the UK. And my goal now is to share the patterns that I've seen on the front line to help you live longer and avoid the diseases I see every day. So the pain of a heart attack is usually not the worst pain of someone's life. It's quite often a pressure, a tightness, a heaviness that's easy to dismiss as indigestion, muscle strain, or even stress. That's exactly why people delay getting help. It's why my dad delayed getting help when he had a heart attack, and that delay costs heart muscle, and in some cases it costs lives. What I'm going to walk you through are the 6 warning signs that people consistently miss or ignore. Not because they're stupid or in denial, but because they genuinely don't recognise them as dangerous. And why would you unless you've been medically trained or you've been told these things? Now, as you go through this video, you may get very worried by some of these symptoms, especially if you've experienced them yourself. But stick around until the end of the video because I want to explain an important caveat and the nuance behind all of this. Who should be worried and who shouldn't? Understanding these signs could save your life or the life of someone you care about. So, why heart attacks don't look like they do in the movies? Before we get into the specific signs, we need to dismantle the biggest myth about heart attacks. And that's the idea that they cause the most severe pain imaginable. Now, heart pain, more often than not, is fundamentally different from the kinds of pain most people are familiar with. Muscle pain is often sharp and localized. Nerve pain is shooting or burning. Injury pain from falling off your bike or falling off a ladder is immediate and intense. Cardiac pain quite often is none of those things. What heart attacks typically cause is pressure, squeezing, tightness, or a sensation of weight on the chest. Patients describe it as feeling like someone's sitting on them, like there's a tight band around their chest or like their rib cage is being compressed. It's uncomfortable and deeply wrong feeling, but it's not often agonizing in the same way that a broken bone is or a kidney stone would be. That disconnect between expectation and reality is what makes people second guess themselves. The clinical reality I repeatedly see is that people with heart attacks often go quiet rather than loud. They stop moving because movement doesn't help. They look profoundly unwell rather than distressed in an obvious way. In emergency medicine, noise does not equal danger. Often silence does. The person screaming with back pain needs assessment and treatment, absolutely, but the person sitting still, who's pale, who's sweating, and looks terrified without making a sound, that's who I worry about the most. And before we go into the first warning sign, if you could do me a huge favour and just check that you're subscribed to this channel, it really would mean so much to me. What that does is it helps this video reach more people like you. And if that helps just one extra person recognise their own heart attack and save a life, then it's absolutely worth doing. So thank you so much, and let's carry on with the rest of the video. So the first warning sign, and the most classic one, is chest pressure or chest tightness. But even this gets misunderstood because of how it presents. Heart attacks usually don't cause sharp, stabbing pain that makes you gasp. What they cause is a sensation of heaviness, squeezing or constriction that sits in the very centre of the chest and doesn't shift. Patients will tell me that it feels like a heavy weight pressing down, like their chest is in a vice, or like something is wrapped tightly around their rib cage. Some describe it as an elephant sitting on their chest, which sounds dramatic, but it actually captures the nature of the discomfort quite well. The key distinction I make clinically is this. If the pain changes when you move, if you breathe in deeply, or when you press on a very specific area, it's less likely to be cardiac. Musculoskeletal pain shifts with movement. Heart pain doesn't. Cardiac chest pressure is constant, it's central, and it doesn't ease when you adjust your position or take a breath. It just sits there, oppressive and unrelenting. And that persistence is what should raise the alarm. If you're experiencing that kind of pressure and it's not going away after a few minutes, that's not something to sit with and hope it improves. That's something that needs urgent assessment. Okay, moving on to the second warning sign, and this is pain that spreads beyond the chest. Cardiac pain doesn't always stay in the chest. It radiates, and the pattern of that radiation is actually one of the most concerning features that we look for in A&E. The reason this happens comes down to how the nervous system is wired. The heart and the left arm share nerve pathways that converge in the spinal cord, which means that when the heart is in distress, the brain can misinterpret where that signal is coming from. This is called referred pain. The nerves from the heart feed into the same segments of the spinal cord as nerves from the arm, from the neck, the jaw, and the upper back. So the brain gets confused about the origin of the signal. What this means in practice is that heart attack pain often spreads to the left arm. That's the most common pattern, but it can also radiate to both arms, into the neck, into the jaw, the shoulder, or the upper back. Jaw pain in particular gets dismissed as dental pain, which is why some people end up going to the dentist when they should be going to A&E. Warning sign number 3. Now, this one is one of the most commonly missed warning signs, and that's upper abdominal or epigastric pain. This is pain felt at the top of the abdomen, just below the rib cage, and it gets dismissed as indigestion or heartburn constantly. The thing is, heart attacks genuinely can present this way, especially in certain groups of people. Not all heart attacks are felt in the chest. The heart sits quite close to the diaphragm, and there's shared nerve supplies with the upper parts of the stomach. Now, that anatomical proximity means cardiac pain can be perceived as stomach pain, and because people associate heart attacks with chest symptoms, they assume what they're feeling must be digestive. They take an antacid, they take a Rennie, they wait it out, and they delay seeking help. This presentation is particularly common in older people, people with diabetes, and women. In these groups, the classic chest pain pattern is less reliable, and epigastric discomfort might be the dominant or the only symptom that you have. What I tell people is this: if you have upper abdominal pain that's new, that's persistent and doesn't settle the way that indigestion normally would, especially if it's accompanied by sweating, nausea, or feeling generally unwell, then you need to consider your heart, not just your stomach. Some heart attacks feel like stomach pain that won't settle, and mistaking one for the other could be fatal, so you've got to go and see a doctor. Now, the fourth warning sign is much broader, but equally important, and that's sweating, nausea, or a sudden sense of feeling profoundly unwell. When a heart attack happens, it doesn't just affect the heart muscle itself. It activates the autonomic nervous system, which is part of the nervous system that controls unconscious bodily functions like sweating, like heart rate and digestion. This activation causes what we call autonomic symptoms: cold sweats, nausea, dizziness, feeling faint, and a general sense that the world might end. Now, patients will often describe a feeling of impending doom, which sounds vague, but it's actually a recognised symptom. The skin becomes clammy, pale or grey, and the person just looks off in a way that's hard to quantify but immediately recognisable to anyone who's spent time in emergency medicine. When someone looks unwell without a clear reason, we worry. And if there's no obvious infection, no obvious injury, no clear cause for why they're sweating and pale, and they are over the age of 55, then the heart moves up in the list of differential diagnoses very quickly. These symptoms on their own might not sound like much, but when they appear suddenly and in combination, they are a red flag that something serious could be happening internally. Warning sign number 5 is a bit more simple, and it's shortness of breath. And this is particularly important because some heart attacks cause very little chest pain but significant breathlessness. When the heart muscle is damaged, it can't pump blood effectively around the body, and that means oxygen delivery to the rest of the body drops. The lungs struggle to compensate, and the result is sudden breathlessness that doesn't have an obvious explanation. This pattern is especially common in elderly patients, people with diabetes, and those with previous heart disease. The chest pain might be mild or even absent, but the breathlessness is pronounced and really frightening. What makes this really dangerous is that shortness of breath has many causes. Asthma, chest infections, anxiety, and people default to those explanations rather than considering the heart. The red flags I look for are sudden shortness of breath that happens at rest with no clear respiratory trigger like a cough or a wheeze, and especially if it's new or different from what that person normally experiences. If you're sitting still and suddenly can't catch your breath, or you find yourself breathless doing things that wouldn't normally affect you, that's not something to ignore. It might be lots of other things, but it could be your heart. The sixth and final warning sign is sudden, unusual fatigue or weakness. This is one of the most subtle presentations, and it's also one of the easiest to dismiss because fatigue is so common and has so many benign causes. The difference here is that cardiac fatigue is sudden, profound, and unexplained. What's happening physiologically is that reduced blood flow from a damaged heart means reduced oxygen delivery to muscles and tissues. The body feels exhausted because it literally doesn't have the fuel it needs to function normally. Patients describe it as feeling completely drained, unable to do normal tasks, or sensing that something is fundamentally wrong with their energy levels without knowing why. The key phrases I hear are things like, "I just felt wrong, I had no energy to do anything," or "I couldn't even walk to the kitchen." A sudden, unexplained exhaustion isn't normal, especially if it's new and comes on without an obvious trigger like an illness or overexertion. If you wake up one day feeling profoundly weak or fatigued for no clear reason, particularly if it's been accompanied by any of the other signs that we've talked about, then it warrants further investigation very quickly. Now, moving beyond the specific signs, I want to talk about silent and atypical heart attacks because understanding this concept ties everything together. Some heart attacks cause very mild pain. They cause vague symptoms or no chest pain at all. These are called silent or atypical heart attacks, and they're more common than people realise. They occur more frequently in people with diabetes, in older adults, or in women like we talked about earlier. And the reason comes down to altered nerve signalling and reduced pain perception. In diabetes, chronic high blood sugar damages nerves over time. This is a condition we call neuropathy. And what this does is it blunts the body's ability to sense pain accurately. In older adults, the nervous system naturally becomes less sensitive. In women, hormonal and physiological differences mean heart attacks often present with symptoms like fatigue, nausea, or breathlessness rather than the classic chest pain. Not all the time, but just more commonly. Now, the important clarification here is that silent doesn't mean harmless. The heart muscle is still being damaged, oxygen is still being cut off, and the consequences are just as serious. The only difference here is that the warning signals are muted, which makes them easy to miss and delays treatment. That delay matters enormously because the window for effective intervention is quite narrow. The longer a heart attack goes untreated, the more permanent damage occurs. Now, moving on to the important caveat. Context matters. This is the section that I promised at the start, and it's crucial because I don't want this video to cause unnecessary panic. If you develop some of these symptoms, like pain in your upper abdomen, fatigue, or pain in your arm, this doesn't mean automatically that you're having a heart attack. In the vast majority of people who have pain in the tummy or pain in the arm or who feel tired or nauseous, your heart will be absolutely fine. These symptoms are common and they have many benign causes. Indigestion is far more common than heart attacks. Muscle strain happens all the time. Fatigue can come from poor sleep, from stress, or just being run down because of work. What matters is context. All of this needs to be taken in context based on your individual risk profile. If you are someone at risk of a heart attack, if you're elderly, if you have high cholesterol, if you have diabetes, if you're sedentary, if you're a smoker, if you have any family history of heart disease, and you develop some of these symptoms, what this video is trying to explain is not to ignore them, you should get them checked out as soon as possible. The threshold for seeking help should be lower if you have risk factors because the probability of these symptoms representing something serious is much higher. On the other hand, if you are a healthy 30 or 40-year-old with some pain at the top of your tummy and none of the other symptoms, this isn't necessarily a reason to go straight to A&E or call an ambulance. Take everything in context. Get some medical advice, speak with a GP or call 111 if you're in the UK, and don't always assume the worst. The point isn't to create alarm, but to create awareness, particularly in those who are at higher risk and might otherwise dismiss symptoms that genuinely warrant attention. So, bringing this all together, the question becomes, when should you actually act on these symptoms? Well, the answer is simpler than you might think. If these symptoms are new, if they're unexplained, spreading, or if they're associated with breathlessness or feeling profoundly unwell, and particularly if you have risk factors for heart disease, you need to get checked. You don't need to be certain it's a heart attack, you just need to recognise that it could be. The threshold for seeking help should be low because the stakes are quite high. It's always better to be reassured in A&E that your symptoms were indigestion or just musculoskeletal than to stay at home and be wrong. I've seen both outcomes, and I can tell you without hesitation that the embarrassment of a false alarm is infinitely preferable to the consequences of delayed treatment. Time is heart muscle, and heart muscle doesn't regenerate once it's lost. And so to close, I want to bring this back to the reality that I see in A&E week after week. Loud pain does not equal heart attack, and quiet pressure does not equal safe. The patients actually having heart attacks often don't shout. They sit there quietly, often looking pale and unwell, often unsure whether they should even be there in the first place. Heart attacks are often missed, not because people ignore symptoms, but because they don't recognise them. This happened to my own dad, and he's a paramedic. People often expect Hollywood drama with a heart attack when what they're experiencing is silent, creeping pressure that often doesn't fit with the script. Understanding these 6 warning signs, knowing when to act, and taking your individual risk into account could genuinely save your life or the life of someone else. So don't wait for certainty. So please, if you have any doubt, then get some medical advice or go to the emergency department.